From aiding in digestion to regulating blood sugar levels, the pancreas plays a crucial role in maintaining our overall health. However, when this organ encounters trouble, the consequences can be severe. In this video, we will delve into 12 signs of pancreatic disease. Stay tuned until the end because we'll also provide preventive measures to help you safeguard your pancreatic health. Sign number 1. Abdominal pain. Abdominal pain is a common and often challenging sign associated with pancreatic disease. It can manifest as a dull, persistent ache or a sharp stabbing sensation in the upper abdomen. This pain is typically caused by inflammation of the pancreas, which can result from conditions such as acute or chronic pancreatitis, pancreatic cancer, or pancreatic cyst. The severity and frequency of abdominal pain can vary, and it may worsen after consuming fatty or large meals. It is important to note that persistent and severe abdominal pain should never be ignored, as it may indicate a serious underlying condition that requires medical attention. Sign number 2. Nausea and vomiting. Nausea and vomiting could be signs of acute pancreatitis. Acute pancreatitis is an inflammation of the pancreas and often accompanied by severe abdominal pain, nausea, and vomiting. The inflammation of the pancreas can irritate the nearby stomach and intestines, leading to nausea and vomiting as common symptoms. This irritation, along with the release of inflammatory mediators, can stimulate the vomiting center in the brainstem, triggering the sensation of nausea and the reflexive act of vomiting. Sign number 3. Diarrhea. Diarrhea is another frequent gastrointestinal sign seen in pancreatic disease. It arises from insufficient production of digestive enzymes by the pancreas, leading to malabsorption of nutrients and incomplete digestion of food. As a result, the stool becomes loose, watery, and more frequent. Chronic diarrhea associated with pancreatic disease can lead to dehydration, electrolyte imbalances, weight loss, and fatigue. Managing diarrhea often involves addressing the underlying cause, such as pancreatic enzyme replacement therapy, dietary modifications, and hydration strategies. Sign number 4. Bloating. Bloating is a discomforting and often visible sign experienced by individuals with pancreatic disease. It refers to a sensation of fullness or tightness in the abdomen and can be caused by various factors, including inflammation of the pancreas and the accumulation of undigested food or excessive gas. Bloating can lead to increased abdominal girth, discomfort, and a feeling of heaviness. It may also contribute to changes in bowel habits and increased flatulence. Managing bloating often involves dietary adjustments such as avoiding gas-producing foods, practicing portion control, and adopting eating habits that promote better digestion. Before we proceed to the next signs, be sure to hit the subscribe button. Sign number 5. Unintentional weight loss. Unintentional weight loss is another common and concerning sign associated with pancreatic disease. It occurs due to inadequate absorption of nutrients caused by insufficient production of pancreatic enzymes or impaired digestion. When the body fails to absorb essential nutrients from food, individuals may experience a negative energy balance, resulting in muscle wasting, loss of fat stores, and generalized weight loss. Weight loss associated with pancreatic disease can lead to weakness, fatigue, compromised immune function, and an overall decline in health. It is crucial to address the underlying cause of weight loss and implement appropriate management strategies, including nutritional support, enzyme replacement therapy, and lifestyle modifications. Sign number 6. Fatigue. Fatigue is a pervasive sign experienced by individuals with pancreatic disease and can significantly impact daily life and overall well-being. The exact cause of fatigue in pancreatic disease can be multifactorial and may include factors such as malnutrition, metabolic imbalances, hormonal disruptions, and the overall impact of the disease on the body. Fatigue can present as a persistent feeling of tiredness, lack of energy, and a reduced ability to perform daily activities. It may be accompanied by physical and mental exhaustion, further impairing a person's quality of life. Managing fatigue often involves addressing the underlying causes through proper nutrition, optimizing pancreatic enzyme replacement, managing pain, improving sleep patterns, and promoting emotional well-being. Sign number 7. Jaundice. Jaundice is a visible yellowing of the skin, eyes, and mucous membranes. It occurs when the bilirubin pigment, which is usually metabolized and excreted by the liver, accumulates in the bloodstream. Pancreatic diseases such as pancreatic cancer, cysts, or tumors can obstruct the bile ducts, inhibiting the normal flow of bile from the liver to the intestines. This obstruction causes bilirubin to build up in the body, leading to the characteristic yellow discoloration. Other associated symptoms of jaundice may include dark urine, pale stools, itching, and abdominal pain. Treatment for jaundice depends on the underlying cause and may involve surgical interventions, stenting of the bile ducts, or appropriate medical management. Sign number 8. Dark urine. Pancreatic disease can affect the color and composition of urine, resulting in abnormally dark urine. Dark urine is often a sign of increased bilirubin levels in the bloodstream, a condition known as hyperbilirubinemia. When pancreatic diseases obstruct the bile ducts, it affects the normal excretion of bilirubin through the urine, causing its accumulation. It is important to consult a healthcare professional if experiencing persistent dark urine, as it can signify an underlying problem that requires further evaluation and appropriate treatment. Sign number 9. Light-colored stools. Pancreatic disease can also impact the color and consistency of stools. Light-colored or pale stools are frequently observed in individuals with pancreatic disorders due to insufficient production of pancreatic enzymes necessary for normal digestion. Inadequate digestion of fats can result in excretion of pale or clay-colored stools. Additionally, obstruction of the bile ducts, often seen in pancreatic cancer or cysts, can lead to decreased bile flow into the intestines, causing stools to appear lighter in color. Sign number 10. Itchy skin. Itchy skin, or pruritus, can be another bothersome sign associated with various pancreatic diseases, particularly jaundice. It occurs when bile acids accumulate under the skin, irritating nerve endings and triggering itching sensations. Itchy skin may vary in intensity and can affect different parts of the body, commonly the hands, feet, and areas with thin skin. Persistent scratching can lead to skin damage, increased risk of infections, and disturbances in sleep patterns. Managing itchy skin involves addressing the underlying cause, such as optimizing bile flow or managing the jaundice. Sign number 11. Back pain. Back pain can be a sign of advanced pancreatic disease, particularly pancreatic cancer. When tumors develop in or near the pancreas, they can exert pressure on nearby nerves, resulting in back pain. This pain may be persistent or intermittent, and it can range from a dull ache to a sharp, piercing sensation. Back pain associated with pancreatic cancer may worsen with movement, certain positions, or deep breathing. It is crucial to consult a healthcare professional if experiencing persistent or worsening back pain to determine the underlying cause. Sign number 12. Diabetes. Diabetes can develop as a complication of pancreatic disease, particularly if the pancreatic beta cells responsible for insulin production are damaged or destroyed. Pancreatic diseases like chronic pancreatitis or pancreatic cancer can impair the production and release of insulin, leading to glucose regulation problems. Symptoms of diabetes may include increased thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. Left untreated, diabetes can lead to a range of complications such as nerve damage, kidney disease, and eye problems. Managing diabetes and pancreatic disease typically involves a combination of lifestyle modifications, such as dietary changes, exercise, and medication to regulate blood sugar levels. If you experience any of these signs, consult a healthcare professional for further evaluation and treatment. Remember, early detection is key to effective management and improving long-term outcomes. Prevention of pancreatic disease. Preventing pancreatic diseases involves adopting a healthy lifestyle and managing risk factors. While some factors like age, genetics, and certain medical conditions can't be changed, there are several steps you can take to reduce your risk. This includes a healthy diet. Consume a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit consumption of red meat, processed foods, and foods high in saturated fats and sugars. Maintaining a healthy weight is crucial, as obesity is a risk factor for pancreatic diseases. Limit alcohol consumption. Excessive alcohol intake can increase the risk of pancreatitis and pancreatic cancer. If you drink alcohol, do so in moderation. Quit smoking. Smoking is a significant risk factor for pancreatic cancer. If you smoke, quit as soon as possible. Seek support from healthcare professionals if needed. Thank you for watching, and make sure to watch more amazing videos from our channel.